Hello, everyone. Welcome back to Gentle Dental. I'm Dr. Sarah Chinnery, and today we have a very special guest. I am beyond excited for you to meet Dr. Kristen Clark, a general dentist with one of the most incredible dental journeys. Originally from Tennessee, Dr. Clark now lives and works at the most northern tip of Alaska, serving the Alaska Native population alongside her husband, Christopher, who is also a dentist. Her work isn't just in the clinic. She travels by a small plane to remote villages to provide essential dental care where access is limited. If that wasn't unique enough, she even shares her town with polar bears. In this episode, we'll hear about her transition from the South to the Arctic, what she's learned from serving Alaska Native communities, and her advice for anyone curious about practicing in a remote location. Plus, we'll be covering some important dental tips and answer questions that you've been asking. So, Dr. Clark, can you introduce yourself and share what inspired you to become a dentist?
Thanks for the introduction. I think you did a pretty great job of introducing who I am. I'm Kristen. My maiden name is Howard. So to differentiate between my husband, who's also a dentist, I often go by Dr. Howard where I work. And I'm from Tennessee, but I live now in Barrow, Alaska, which we now call Utqiagvik. A lot of us here will still call it Barrow. So if you hear me and talk about both places, it's actually the same city. We just have an interesting way of calling our town by two different names. What first introduced me to dentistry was working inside of a homeless shelter within my community in Tennessee. And I got to observe and work with some excellent volunteer dentists who were coming in once a week to help with community needs there at the dental clinic.
And is that where you met your husband?
It is also where I met my husband. It was a crazy time in my life because I was about 2 months away from moving and starting my own dental journey to becoming a dentist.
How did you go from Tennessee to living and working at the northernmost tip of Alaska?
The Inupiat name is Utqiagvik, means home of the snowy owl. So we have those cool snowy owls, which are beautiful here. I first was interested in moving to Alaska during my dental school training. I wanted to rotate here and I applied, and it was looking like it was going to happen until the COVID pandemic hit. So we didn't get to come here as a rotation. Instead, towards the end of my career working and hopefully becoming a dentist, last 4 year of training, I got an option to apply for some of the jobs that they had available here. I interviewed for the job position. I asked how many positions were available, and they were like, well, if you know somebody, then we do have the option of hiring 2 dentists. And I said, great, I think I know somebody. It all worked out really well that we were able to both find jobs and relocate here.
What was it like adjusting to the climate?
Climate wise, it was fascinating. We first landed here in August, which is our warmest month, and it's still not extremely warm by lower 48 standards. Usually in the mid to high 50s as our max during the summer. In preparation for that, we bought parkas and muck boots and nice fancy gloves and mittens, and we enjoy the cold weather now. We don't get out for a long length of time during our coldest months, which reach up to -30 Fahrenheit and wind chills of up to -60s or 80s if it's extreme. But we do enjoy the snow. It's been fun. The weather is always interesting.
That's crazy, especially coming from Tennessee where it's definitely mild.
Yeah, and Tennessee is very humid, but what people don't really expect when they reach here is that we're a tundra, which is a desert. It's a desert cold, so it's extremely dry. It was one of the more difficult things to get used to is how thirsty you usually get as you first arrive, drinking lots of water.
What was it adjusting to the culture?
Culture-wise, everyone here is very welcoming. The culture I serve is the Native Alaskan village of, it's a Inupiat Eskimo, and they are usually pretty welcome. We've attended a lot of different cultural opportunities here. One of the exciting ones that often people see is the summer whaling festival that they hold, and there's the community blanket toss, which is this giant sealskin tarp that's stretched, and it's really fun to watch as the whole community kind of bounces people pretty high into the sky. It starts at about 7 feet. So to even get onto the sealskin blanket, you have to have people kind of hoist you up. I've never been on it. I'm too scared, but it's
I
so
was
fun
gonna
to watch.
ask, did you get Chris on there?
No, it really is kind of intimidating because it requires a lot of coordination and balance. And if you're not used to it, you bounce off the wrong way.
Can you talk us through what was it like moving to Alaska? Because last time I saw you, you were driving your truck from Tennessee all the way to Seattle to put your truck on a barge.
The truck made it. That was fun. Drove the truck cross country to meet the barge. It's with Marine Barging Company, and they shipped it from Seattle to the northernmost point here. That barge only leaves once a year. So we were really lucky to make it just about days before it left. And then our truck met us here about a couple of days before we arrived. And we've enjoyed having that vehicle here. It's very nice for getting around and seeing things. The rest of our items we had to pack in totes and ship because there's no roads that lead to Barrow, Alaska. It's only by airplane and air cargo.
Assume you packed light.
We managed to pack light, and then we had an interesting encounter at the UPS center where they were like, "Where is this going? It doesn't register as a place that we ship to." And I said, "Yes, I know, but it actually will make it there, I promise."
Is there a local grocery store? Do you have to ship things?
There is a local grocery store, our Alaska cooperative. We call it the AC store, and it's a it's a chain. It's here in Alaska. It's also here in Utqiagvik. So it's very small right now. The larger grocery store we had as a second alternative did close a year or so ago. We have another local, really fun grocery store, Kanika's Market, and it carries some Asian foods as well as a lot of different like pantry items. For most of my shopping, I do a little bit of Target and a little bit of Amazon. No, it's not 2 day shipping, but it usually does get here within around 3 weeks or so, maybe longer, depending on what kind of air cargo situation we were looking at. The other cool thing that I forgot is we do have a subscription service that will show up to our work that we can order fresh fruits and vegetables from. And sometimes we're also adding in some organic meats, a little bit pricier, but it's a nice thing that we have an option to working at the hospital as dentists. And as far as how it arrived, usually in one piece. And thankfully, most of the shipping companies these days are pretty good if it arrives broken or damaged or boiled or fired.
For people that may not be familiar, can you describe the community you serve? How many people live there and how big is your clinic, as well as how large of an area that you serve?
Our main hub practice is located at Samuel Simmons Memorial Hospital. We're a dental clinic in a hospital setting, which is a little unique. We have a 10-chair operatory clinic here in Utqiagvik, and then we serve 5 remote villages here across the North Slope, and those include Akasuk, Nuiqsut, Point Lay, Wainwright, Nuiqsut, and Kaktovik. And each of those have a health center that is a multifunctional health clinic. We have a room dedicated to dental in each of those. Population size of Barrow is around 4,500 people. Population of the whole North Slope Borough includes a few more communities. Each of the communities we serve is about 200 to 500 people.
What's it like traveling by small planes for dental care into remote villages? And then, like, how many people are you traveling with and living quarters like when you're going there?
Yeah, great question. We travel by what you could consider a bush plane. It's an 8-seater, similar to like a Cessna style plane. We load down with totes. We take things like our disposable like gloves and some materials. Instruments are usually at the clinic. And then we take about 1 to 2 dental assistants with us when we leave. We're traveling with other people who are also going to that community, and we're also traveling with other goods that are going to that community. So it could be anything from snow machines, bikes, and motorcycles that they're cramming into this tiny 8-seater plane with us, or school's pizza that they ordered here. And I've traveled with probably hundreds of boxes of pizza or the community groceries. So it's a fun experience. We land on runways that are packed snow tundra, or during the summer months, it's a dirt runway. When we get there, there's not an airport. It's just open field. So everybody drives up in their big trucks, and we load off the plane into the trucks and head into closer to the to the village.
That's crazy. So how do you get scheduled, or is it something that's planned ahead, or they just kind of hear a couple of days and line up, or how does that work?
Our visits are scheduled. It's usually a Monday through Friday event. And our schedule goes out to each of the community health centers and they post them inside the community health center. And they're also supposed to share that news either by VHF radio or social media accounts and word of mouth. When we get there, we start calling a lot of the patients that we know either have toothache or high need. And from there, we make the schedule kind of day of.
I live out in the country, and so sometimes cell phone service isn't great. And I know you're having some technological difficulties with your Wi-Fi. Do you have cell phone service when you're out in the remote villages?
Yes, sometimes and no other times. We have a lot of difficulties. Some patients here don't even have cell phones because it's unreliable, and that can be tricky to communicate to them. VHF radio is another way that a lot of the small communities will radio, and they keep that radio on and they hear their name over the radio. They're like, hey, yeah, what do you need? There are still a lot of cell phone usage as long as our landlines, or if you have AT&T, that's the primary kind of bigger name cellular network that works here on the North Slope.
What are some of the biggest challenges of working in such a remote location?
Shipping can take a long time. So receiving materials or sending materials, and also it's sometimes tricky to recruit staff and maintain staff. There's some turnover. It's the severity of our temperatures and the severity of day and night circumstances that surround this northern Arctic Circle weather and daylight and darkness hours. We also struggle a little bit with referrals, few specialists here in Alaska, but it can be challenging sometimes connecting our patients to care that's beyond what we're able to administer here.
Because you have to go from a plane or a boat to get anywhere. What would be the closest mall or Target?
The closest connection we have is actually Anchorage. I know that's not the closest by physical distance on the land map, but we have a once daily flight that flies from Alaska Airlines directly to Utqiagvik, and it connects only to Anchorage right now.
So how long of a flight is that?
It takes about an hour and a half.
How does the local culture influence the way that you approach patient care?
Culture is very quiet, and I think the first time I moved here, I noticed how loud my southern accent projects. For the most part, you're having to ask the right questions. Usually get a 1 to 2 word response. More interesting thing is I learned to pick up on nonverbal cues a lot more. A lot of the community talks with their eyebrows. So for instance, if you ask a yes no question, if it's a yes response, you'll get a little eyebrow raise. And you have to be on the lookout for that because we have the patients wear safety glasses in dentistry. So it took a little bit to get used to learning to look for that cue.
What's something that you've learned from your Alaska Native patient that has impacted you either personally or professionally?
I think it's the resilience and the resourcefulness of living here. You may not have a lot of access to resources. They could be limited, but you still make do with less, and the flexibility and the ingenuity that comes from it.
Okay, so we have to talk about polar bears. What's it like living somewhere where there might be polar bears wandering in town?
Polar bears are here year round. They're more common in the colder months, but polar bears, interestingly, do not hibernate and they only den when they're having babies. So we see polar bears just around town. Usually it's a big ordeal. Everyone still really gets excited every time there's a polar bear. Don't see them as much within city limits. They're usually kind of on the outskirts of us. Now, there were some things like that I heard before I moved up here, like, oh, people don't lock their home or people don't lock their cars because you have to be able to run away from a polar bear. I don't think that's so much true as it's just there's not a lot of activity here for people to run away with your truck or vehicle. So people with their vehicles in their car and their doors open quite often. I think one of the more interesting encounters my husband had is looking for northern lights in the middle of the night. He was parking somewhere and then the next thing he knows is polar bear and her cubs come from right around the garbage can. And thankfully was inside of his truck the whole time.
What's the most memorable wildlife encounter that you've had so far?
There's a lot. I did get followed for a few days following during a week of an Arctic fox. I would start out at my apartment and walk to the hospital, and you would just follow. It was kind of a little scary because they are very adorable creatures, but they are still very ferocious. And the probably other cool one was that we are from a whaling community. The Inupiat tradition is whaling. That's what brought them here along to the Arctic slope. And the whale, bowhead whale specifically, and it's pretty awesome to see how they make use of that whale for a large community.
How does the extreme climate affect your everyday work and travel?
People would predict it's the cold weather, like we get snowed in because of blizzards, but it's more often that the low hanging cloud coverage is affecting our travel. It lessens the visibility for landing for pilots. The weather is cold, but the more challenging thing I think for us to get used to is the 24 hours of daylight for like nearly 3 months of the year, and then the 24 hours of no sunrise for about 60-ish days. The sunlight's worse than the darkness, though. It's easier to sleep when it's dark. It's harder to like get on a routine sleeping pattern, and when it's bright outside 24 hours. We do get some light. It's like a twilight that we get usually midday, and that twilight kind of lessens the closer you get to the solstice. But when it first starts out, you have several hours of almost what you would consider normal visibility. Just doesn't have the bright glowing orb of the sun in the sky. It's below the surface. We usually have employees that really get confused when it's daylight because if your alarm is set for 2 a.m. instead of, I guess, wanting to take a nap until 2 p.m. or something, you wake up at 2 a.m., it looks like 2 p.m., and you get confused.
What kinds of dental needs do you most often see in the communities that you serve?
Cavities, really, really high incidence of dental decay, has probably a lot of multifactorial issues involved. We've got hygiene being an issue, diets being challenging, environment plays a role. We have a very dry environment. We also have an environment where most people are indoors and not receiving levels of vitamin D that you would hope for. The genetics play a big issue too. Extra teeth, extra roots, teeth crowding, jaw misalignment relationships, and overall high biofilm passed down and spread. The program is maintained by the North Slope Borough. We have safe drinking water here on the slope, especially in Nukayavik. It can be challenging for more of our outlying villages. They're on boil alert for months' notice, so that's a little bit trickier. We have a good plumbing crew here, and they are active if something does bust, and we so far not had to experience any downtime from water issues since we've lived here. It's constantly running, which is weird. I don't think that's exactly how it works in lower 48. So the pipes here are running warm water, which I don't like the taste of warm water, so I use a lot of ice. That's one of the workarounds I think that helps kind of keep them from freezing.
How do you handle more complex cases if specialty care isn't nearby?
Definitely working within the IHS, we do have some resources. We've got a connection to Anchorage that serves as our primary outlet for referrals, especially oral surgery or pediatric for full mouth dental rehab cases where the cavities are extensive and involve a lot of the primary teeth and maybe even some of the adult teeth. So that is helpful, and it's a very good resource for patients. If there's other need, then it's usually private practice and more frequently Anchorage since it's our easiest flight and location to get to. But an oral surgery referral program within the IHS, so we're able to refer IHS patients, Native Alaskan beneficiaries to Anchorage if they have problems too difficult for us to treat here. Both of those options, either a lot of impacted wisdom teeth, we wait until the surgeons are here and present in Barrow to offer those services. And then if it's something more urgent in the meantime, but we do a version of telehealth dentistry. In each of the villages, we call them health aides, and they're able to triage a lot of dental symptoms. They'll write down everything they can visualize and maybe send us a picture. and we decide if it's something that warrants an antibiotic. If they do have some insurances that allow them to travel on that in cool relationship with some oral surgeons on the East Coast. They travel to us for once a week, twice a year, so usually spring and fall. And we have insurance costs, and we will work with them to get them seen here in Bureau. And if it's something that can be delayed or with an antibiotic, it will help to at least help manage some symptoms until we're able to reach there. We'll help it. We'll treat it then. We're really fortunate to have a really great orthodontist that's working with us. She comes up for a week at a time every month. That's been a really good blessing to treat some of our really complex cases of crowding and misalignment and impacted teeth, teeth going in the wrong position, transposed teeth that are really common here. It can be tricky to treat too. So our orthodontist is really valuable and we're glad to have her.
What are some creative solutions you've had to use when resources weren't available?
Did have a situation where I was in a village and I didn't have any fan and loop space maintainers. And fortunately, the child did have one on the other side of the arch that they no longer needed there. So having to remove some teeth on the other side, we got a little creative and made that existing space maintainer that they no longer needed on one side, we moved to the other side. Not your typical thing to do, but the parent really appreciated it, and I think it has helped serve the kid.
How do you encourage preventive care when regular dental visits aren't always possible?
It's challenging. We send out toothbrushes and toothpaste pretty routinely through the school systems, start of the year, mid-year, end of the year, and we also have hygienists that travel to each of the villages too. We encourage public health nursing to apply fluoride when applicable.
What's your go-to advice for maintaining oral health between visits when access to a dentist is limited?
Oftentimes are really encouraging brushing when we're not there, making water primary water like beverage source. But we try our best with prevention. Fortunately, a lot of times it's usually when we arrive that we're in the treatment mode. Being a varied diet, but a diet high in hopefully amino acids and protein that can help mitigate acidity. So L-arginine is a good one that's coming up. It's found in a lot of fish, poultry, nuts, legumes, seeds. And what we see is that when the bacteria in our mouths metabolize those food groups, then they create more of a basic environment. Cavities tend to form when it's only really acidic, down to a pH of about 5 points. So anytime we can move that up closer to neutral or even basic, we have less overall dental disease.
Do you have any favorite products for preventing cavities or gum disease in challenging environments?
We highly recommend a lot of fluoride containing products. There's prescription strength fluoride, toothpaste, mouth rinses. We have Prevenant. We also encourage like mouthwashes that are basic in nature or have basic pH, like Bear Breath, which is marketable and you can purchase from Amazon and other like department stores. We even encourage baking soda as that will help to improve pH environment and make the mouth less acidic. So mixing some baking soda and water, swishing, spitting. There's other cool products that are on the market that we apply in our dental offices, things like Curadont, and there's also live povidone iodine, which has been shown to be more antiseptic and remove some of those pathogens that lead to a lot of oral health issues.
How important is diet for oral health, especially in areas where fresh produce might be harder to get?
It's a challenge, and diet's something I think that we see that contributes mostly to the high cavity risk that we see or the high cavity incidence, the decay. Diet here tends to consist of a lot of processed foods, a lot of high sugar containing and high carbohydrate containing shelf stable items. We encourage as much as possible what we call in Alaska a subsistence diet. It focuses on traditional hunting methods to procure more food, things like fresh salmon and the Nupia culture, bowhead whale, and they also hunt for caribou here, which we call tutu and the Nupia. I don't know many Inupiat language words, but that one's one of my favorites. So caribou is tutu.
For dentists considering working in a remote location or underserved area, what should they know before they go?
I think it's most important that their patient, like themselves and their kind of knowledge that they know that things will be slow and you have to understand that, flexibility, if the flight gets canceled, there's not much you can do about it, but wait it out. Knowing a lot of the community functions on island time. If their appointment's at 2, it might be 2:30 before they show up, and that can be challenging.
What skills or traits are most important for thriving in a rural or remote practice setting?
Communication's a big one, and knowing your audience. And we're taught as dentists a lot of really large words and vocabulary, and you meet people who have limited experience with dental care and also limited experience with knowing a lot of terms that we use. You have to be able to accurately explain those and know if they're truly comprehending.
What's the most rewarding part of your work in Alaska?
It's exciting to improve smiles, especially in the more aesthetic zone of those areas along the front teeth. I had an encounter once where I was in a village and I was working almost canine to canine in the front of 4, 5, 6 teeth, and the cavities were pretty severe and made a big difference. And they came back the next day. They said, I won my competition, having a target shooting contest in its own community. And parent was like, yeah, she was smiling ear to ear. So that was fun. That was special.
What's been the most challenging part and how have you overcome it?
Be challenging being almost the last or only resource. So learning to develop some of those skills so you can treat more and able to offer more services to each patient.
How do you spend your free time? Any favorite hobbies or local traditions?
We enjoy cooking a lot, so we managed to locate all of the ingredients and we do a lot of cooking. We also like to drive around town. I'm getting into photography, so we can either go out at night, see the northern lights during the winter, looking for polar bears, or we stay indoors, like reading puzzles, some binge watching. We have a hydroponics garden, which we really enjoy. So we're able to grow some lettuces and some herbs, and we've even had tomatoes and some interesting peppers and those kind of things.
What's something you miss from Tennessee and something that you've grown to love in Alaska?
Do you miss trees? We're flat and no trees here. I also miss a summer sunset. It's nice that we get to experience the midnight sun, but it's a little bit sad that sometimes you don't get that kind of twilight hour at summertime. It's a cool experience in Tennessee. But things that I do love about Alaska that I didn't think I would enjoy is like I actually do really love the snow. And when we're visiting other parts of Alaska, we love the mountains. Something that we really enjoy. Being near the ocean is pretty cool too.
Dr. Howard, thank you so much for sharing your story and giving us a window into life and dentistry at the most northern tip part of Alaska. Your dedication to serving remote communities, often in challenging conditions, is such an inspiration. If you've enjoyed hearing Dr. Howard's story or learned something new about dentistry, please like this video, leave a comment with your favorite moment, and subscribe. Don't miss future conversations with amazing dental professionals around the States. And if you have any questions for Dr. Howard about life or dentistry in the Arctic, drop them in the comments. Thanks again for watching Gentle Dental as we are spilling the beans on different styles of dentistry. See you next week.